Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, joined as always by my older and sometimes on certain things, but not often, wiser brother.
It just
Welcome, brother.
never gets old for you.
I don't know.
You don't ever tire, but
yeah. And if anybody out there can help me write better intros of introducing Steven, send them to the Family Pet Podcast at gmail.com. Let me know. Give it. I know what I need to do. I need to go to Chat GTP.
yes.
And be
How
like,
to
help
introduce
me.
my
What's it?
loving, helpful, friendly, handsome older brother.
Yeah, it may say, sorry, I don't write fantasy world intros. No. Anyway, well, have you been using the AI stuff very much, like the Chat GTP since it
So
came out?
I'm actually working with AI generated music for our hold messages. So I'm going to create my own music rather than trying to find royalty-free music.
Okay, so you're just going to create your own
I'm
stuff.
going to create my own song.
I had to buy the intro music for the Family Pet Podcast.
And ironically, that actually appears on the MLS package on Apple TV. It's the same song because I heard
It can't be the same song. I bought this, or maybe I just bought rights to it.
You bought rights because they use it in their halftime show.
Okay.
So it's a popular song.
It's I don't know if our listeners appreciate it or not, but we are pretty energetic people, and that music, when I was going through and listening to all the different samples, that was the one that got me the most excited about the podcast.
I'm not creating quite that energetic music for hold music.
Because not everybody calls the vet in happy times. And it's not always appropriate to have bumping bass, pump you up music.
Yeah. Sometimes they call and it's a difficult conversation to have. So we have to be respectful of that.
Well, I was wondering how we were going to intro today's guest, but I think we just did. We segued in.
You're so good.
Sometimes people call us because their pet has health problems, and sometimes we end up diagnosing many pets with cancer. And so today, our episode is all about oncology, and we'll talk more about the definitions there here in a little bit. But today's guest, we have Dr. Marlowe. She is from the Veterinary Care and Specialty Group out of Chattanooga. We're excited to have her, but she's going to be talking to us all about veterinary oncology today. Dr. Marlowe, thank you for joining the Family Pet Podcast.
Thank you so much for having me. I'm excited to be here.
I assume when pet parents get to you, they're not always happy to see you, are they?
Right. It can be a difficult introduction and kind of difficult initial consult. And I mean, I think the most important thing is that we're laying out all the options. So I want owners to be informed, to have all the information they need to make the right decision. So it's not necessarily a true right or wrong. It's more of what's appropriate for that pet, that parent, and trying to ease into that conversation to have all that information. But there can be tough conversations, and then there also can be really good days when patients are in remission and doing very well and finish their protocols and that kind of thing too. But I think I want people to be informed so that they know that they've made the best decision for them.
Well, we are excited to have you on this podcast episode to talk about oncology. This is your opportunity to inform our pet parents, our curious pet parents out there, before hopefully they never will need to see an oncologist for their pet, but they can go back and remember this episode today. So we're going to try to educate our pet parents today about the veterinary oncology world. So
Perfect.
I think a good place for us to start is many of us are familiar with human cancers, and cancers can affect our pets. Can you just kind of compare and contrast what people may know about human cancers and how they may or may not relate to cancers that we see in our pets?
Yeah, and a lot of cancers can be very similar. We actually use some cancers in veterinary medicine to be kind of early research for what then goes on to be developed for humans. So there is cancer that's very similar. Cancer by itself is a single cell that gets a mutation that starts to then grow out of control. And so that very basic biology is the same. Different types of cancers happen more commonly in different species. But there are some things like bone tumors that are very similar in dogs compared to people. And so then somehow how they present, some of the treatment options are very similar. Goals are a little bit different for veterinary oncology versus humans. Yes, we like to cure patients if we can, but even more important is the quality of life that they have. So a lot of our treatments are aimed more at that quality than extra quantity. But a lot of the actual types of cancers can be very similar between humans and dogs and cats.
You listed bone as a very similar, but you talked about different types of animals get different types of cancers in frequency. What are some of the most common cancers in animals?
Yeah, so across the board in dogs and cats, one of the most common types of cancers we see is lymphoma. That presents very differently in dogs versus cats. So lymphoma is a cancer of a white blood cell. And in dogs, that presents with big lymph nodes, so glands or swellings that are under the jaw. Oftentimes, you can feel these external swellings. Versus cats that get lymphoma, actually the most common presentation is intestinal. So actually present with weight loss or vomiting, those kind of things. So the same cell that's becoming cancer, but very different appearances from dogs versus cats. But that's probably the most common type of cancer that we see in both those species.
Do cancer, so you define cancer as a cell that has an abnormality for some reason, and then as that cell replicates, the cancer or the abnormality replicates and replicates. Can you kind of talk about that a little bit more and like how that works? Does that abnormality cause that cell to quit functioning, or is it just like, why is cancer, this is going to sound weird, but why is cancer bad?
Yeah, no, exactly. So cancer truly could be still the idea of benign versus malignant. Cancer is a cell that's growing when it shouldn't be. So your normal cells in your body, there's a very strict regulation to tell your cell to divide, to grow. Okay, stop. We don't need you anymore. And then cancer gets a mutation that they bypass that normal regulation. So they start growing out of control. And so even a benign tumor in a place that increased growth causes a problem. So even you think of like a benign fatty tumor or lipoma, if it's underneath the armpit, if it grows big enough, eventually just that mechanical obstruction can be a problem with like walking for a dog. But then you have tumors that are more malignant and they invade. So if you have a tumor in the liver, that can invade into that normal liver, cause liver dysfunction, cause bleeding. And then the other thing that truly malignant tumors can do is spread to other places. So oftentimes it's that spread. If you have spread to lungs, then your normal lung tissue isn't able to do what it can do. So it can't filter that oxygen. And so the more and more cancer tissue that becomes that, you're coughing, they're not breathing well. You see those clinical signs because that normal organ can't do what it's supposed to do.
Are there, so there's just so much here.
Sometimes
There's just so much.
You've short circuited our brains for a second.
Okay.
Right. And I'm just trying to process this through. That these cells start behaving irregularly and we have cancer. What causes it? Why do they do this?
Yeah. So truly cancer is a genetic disease. So something happens in the cell DNA of mutation that causes it to misbehave. Now, what causes that mutation? There's a bunch of different reasons. And most of the time, we actually really don't know, especially in dogs and cats. The research is still very early in this process of why. But there are some things that we do know. So a very specific one would be mammary tumors in dogs and cats. We know that if dogs and cats are spayed earlier, they don't have that estrogen exposure and they don't get near as a high risk of mammary tumors as a dog or cat that's spayed later in life. Some breeds, so golden retrievers, there's actually the Morris Animal Foundation is doing a lifetime golden retriever study right now because we know golden retrievers get so much higher risk of cancer compared to other dogs. And so they're trying to say, okay, are these dogs born with a mutation? And have we kind of bred them so specifically that they're passing that on? Or are there different environmental exposures, if there are different toxins living near power plants or radiation areas? Are there different kind of environmental exposures? Secondhand smoke, I mean, that's a very common one in humans. Well, primary smoke exposure, but then secondhand for veterinary patients can increase risk of some cancers. And then there's some other breeds, like a Scottish Terrier, is very predisposed to getting a bladder tumor. So now there's actually a mutation that you can test for in their urine to see if that is a bladder tumor, if you see a mass. And so we're kind of trying to see not only why do they develop this, but then is there a way that we can test early and try to figure this out and either prevent or diagnose early if we can figure that out.
What are the other ways that we diagnose cancer in our pets?
Yeah, and it's tricky because we kind of think about cancer as one disease, but there are so many different types are very different. So probably a common way is having a mass or swelling on the outside of the body. And then we can do a needle sample of that, get cells out, look at them in the microscope and say, are these cancer cells? If so, what type? And then a lot of things can be a little bit less specific. So if you have an older dog that's coming in with its very tired and is vomiting, you might do some blood work and see changes on that, or do an ultrasound and see a mass somewhere. So there oftentimes these signs may not be exact for cancer. It may be, okay, this is going to lead us to do a test that then may lead down the road to kind of getting that diagnosis. So the common one in dogs is having big lymph nodes on the outside of the body, which sometimes owners or pet parents will notice. They might feel a swelling under the jaw and bring them in specifically for that. Or sometimes they're found on routine exam. They're seeing a primary care vet and they notice big lymph nodes. And so they take a needle sample and submit those. Sometimes you can see abnormalities on blood work, like having a very high white blood cell count, but not always. And I think that's kind of a common misconception when people come to me is they say, are you sure it's cancer? The blood work was normal. Mm-hmm. And the blood work is very good for general screening of how organs are working and like what your white blood cell count is. But there are a lot of tumors that if they're localized to one area, especially like on the skin somewhere, you're not going to see anything on the blood work. So while it's a very good screening test, it's not a specific test for cancer.
We mentioned AI earlier today, talking about Chat GTP writing our scripts sometimes. We've noticed we've started using AI. We're kind of trialing it out right now with digital radiography. So where the AI reads the X-rays that our team takes. Are you all using AI technology in the diagnosis of cancers?
Interesting. So the only what I can kind of really think about for an example is there's a company that's called Impromed. That it's not so much as diagnosing cancer, but as helping form treatments. So dogs with lymphoma, we have very standard kind of chemotherapy protocols that we treat dogs with. And you expect certain dogs to do well. Some dogs have certain prognostic factors that you worry are they not going to do as well. So for the longest time, you kind of treated all these dogs the same. Impromed, you take a sample from the lymph node and you submit those cells to this company, and they have an algorithm that they've made to determine what chemotherapy might actually work best for that type of lymphoma. And so there's a truly AI algorithm that they've made. But that's really kind of the only way I think about that I'm using it directly right now.
Is that some of the specific, patient specific cancer treatments? Is that I've heard that in the news and human meds? Is that the same kind of thing?
It is very similar. That is specific for lymphoma right now. They're trying to look at kind of other tumor types too. And it's a chemotherapy sensitivity panel. So it's still kind of broad chemotherapy drugs. The truly targeted therapies I think you're referring to there are a couple of companies that you take a piece of the tumor, you send it to them, and they do a DNA analysis of that tumor. So instead of treating all sarcomas the same, it's, okay, does this sarcoma have a mutation that then we can target with a specific drug?
Okay.
And a lot of those drugs come from human medicine. So a lot of those drugs have very basic safety data. So a lot of drugs are tested on dogs before people. But there's not a whole lot of efficacy data or how different patients with different cancers tolerate them. So it's a kind of early and a very good theory, but still kind of working to see how does that pan out. Because cancer is not always that black and white, as we're kind of getting into. You might have a mutation. Does that mutation drive the tumor? Is that the only mutation? What happens when more mutations happen in a tumor? So you can get some really good effects when you target specific mutation, but it's not really as black and white as then you're stopping that tumor from ever growing or being a problem.
So you've referenced a couple of different things. You referenced chemotherapy, you referenced surgery in and of itself. Are those the ways that we treat cancer? What are the ways that we treat
Depends,
cancer in
right?
our pets?
The answer is always
Absolutely.
it depends.
Yeah, and it's kind of that same idea of cancer being so much more broad in different types. But yeah, so if there's a primary single mass, surgery is almost always going to be the best option if we can do it. Now, whether that surgery alone is a curative intent type procedure, or if it's a type of cancer that has a higher risk of spreading somewhere else in the future, then we may follow up that surgery with something like chemo type of cancer. So lymphoma, cancer of a white blood cell, most dogs have multiple lymph nodes. So there's not really an option for surgery. You're starting with chemotherapy to kill those cells. And those dogs have a very good chance of going into remission, which is different from a cure, but putting them in remission would be no evidence of lymphoma. They feel good, they're happy, and then trying to maintain that as long as we can. Radiation therapy, which we just got a very fancy radiation machine put in, a linear accelerator, and have a radiation oncologist here now. That's an awesome tool to have as well. It's also a localized treatment, kind of like surgery. If you have a mass that's too big to go to surgery, you can use radiation to try and shrink that, make them more comfortable. Or there are some kind of curative intent approaches to that too. And then some of these more targeted approaches, we mentioned those medications to try and target certain receptors or mutations. And then there's like immunotherapies. There are certain vaccines that are becoming available. And then there's actually now a newer treatment for a certain type of tumor called a mast cell tumor, where you inject this medication directly into the tumor to cause it to kind of die from the inside out. So a lot of different options that we kind of try to individualize to not just that cancer, but to that pet parent and that pet is what is the best option for them at that point.
It's amazing to me that you can be that targeted. Like, how do you affect just certain cells and not the whole entire body? Like,
yeah, and sometimes we don't. So traditional chemotherapy drugs, the way they work is by damaging DNA. So they're killing fastly dividing cells. Cancer cells are growing much faster than any other normal cell in the body. So it's preferential to killing those cells, but you're going to kill some normal cells. And that's where we differ from human medicine a lot of the time. So I'm going to use lymphoma again, because it's a very common tumor that we see in dogs treated with chemotherapy. We use a lot of the same drugs that humans use, but very different protocols, very different doses, so that we kill these cells, put these dogs in remission. But the chance of causing stomach upset, where in people that's almost a guarantee, in dogs, mild stomach upset's about 25%. And mild to me means they go home, they may have an episode of vomiting, but you give them an anti-vomiting pill, they feel better. Maybe it's 24 hours, but it's not overall negatively impacting quality of life. There's a 5% chance of a dog getting chemotherapy and getting really sick from that chemotherapy. So we're killing these fastly dividing cells. The other cells that are targeted are your normal white blood cells in your body. And that's what people think about for humans getting cancer in a hospital that are immunosuppressed. Their white blood cell count drops really low. So in our patients, the doses that we've made, have studies on, there's a 5% chance of that white blood cell count dropping very low, that then they feel sick and they have a fever and need hospitalization or kind of more treatment for that. Dogs don't lose most dogs don't lose their hair.
I was going to ask that question.
Yeah.
I was waiting. I was ready.
Oh, we were both going to race to ask that
Jump on
question.
that.
Okay.
So humans, your hair grows constantly. In dogs, most breeds of dogs, fur is all their different furs in a different phase of the cell cycle, which is why they shed, but they don't lose all of their hair. So that coat may get a little bit thin. Those golden retrievers with those beautiful tails may get a little bit thin. The breeds that really can lose a lot are those hypoallergenic poodle breeds, because they truly have hair like we do. And so they actually can lose a lot more. It's really cosmetic. It doesn't hurt them. And then actually when it comes back, oftentimes it comes back as a little bit of different texture or color. But most dogs do not lose their hair on chemotherapy.
All right.
What is the quality of life considerations for pets with cancer? Because a lot of this sounds in depth, but you talked about they're not losing their hair and they're not immunocompromised through the treatment. So how does cancer treatment affect quality of life?
Yeah, and the goal is to make it as minimal as possible. I mean, most of us in this because we love animals and we love doing what we do. And I wouldn't do this with my life if all my patients were miserable and sick. And, we want them to feel good during this. So for chemotherapy, we talk about 25% chance of mild stomach upset, 5% chance of that very low white blood cell count. That means about 70% of dogs are coming in to get their treatment. They go home. Cats tend to do even better. I see even less kind of stomach upset and low white blood cell counts with cats. So the other things that change a little bit are, we don't know exactly how low their white blood cell count's going to go. So maybe these dogs shouldn't be going to dog parks or boarding. And for some dogs, does that affect their quality of life? For some dogs, a kind of intense protocol for lymphomas, they're coming in almost every week for 19 weeks. And your happy-go-lucky golden retriever, they may not care. They may actually love coming in every week and meeting new people. And some dogs, that's too much. And so we talk about there's some protocols that are every 3 weeks, or there are some protocols that are medications you give at home instead. So I think there's a lot that goes into that quality of life besides just, does chemo make them sick or does radiation cause side effects? It's also them as a whole and looking at what the owner is able to do with travel costs, those kind of things. We try to take all of that in consideration to try to maximize the good time that the pet parent has with the pet.
I will ask, you brought it up, cost. I know we have the ability to do a lot of things with our pets now. Can you talk a little bit about cost? I know that it depends on what type of cancer and what treatment approach we take, but
Right.
talk to us a little bit about the financial commitment to entering into cancer treatment for your pet.
And I will say, you guys probably seen this too. A lot of people more commonly are getting pet insurance for pets. And so a lot of the insurances that I see, I don't work directly with those companies or anything, but a lot of them will cover these treatments too. So that's nice to kind of take a little bit of that cost out of that decision making. But for most discussions that we have, we try to have a few different options. The gold standard for surgery followed by chemotherapy, you could be in this $6,000 to $8,000 range. For lymphoma, a full that kind of 19-week protocol I mentioned that has the most efficacy behind it could be close to $7,000 to $8,000. And for some people, that's just not an option. And again, we're coming in every week, whatever reason. So there are other options that are, well, if we do something every 3 weeks, then could we get that down to $4,000 to $5,000? Or could we do something at home where you're paying, a few $100s a month kind of thing? And I think that's where what I would really try to get across is like coming in for that initial consult. My goal is not to push chemotherapy or to push this treatment. It's to make sure that the pet parent has these different options to say, okay, what's the best one for me? And whether cost plays into that, logistics of travel, the patient's temperament or wanting to come into the hospital as frequently, we kind of try to put all of that into making that plan for that pet parent.
It sounds that you take the same approach that we do here, which is not to tell people what to do, but to give them their options and work with them on coming up for the best solution for their situation.
Absolutely. Absolutely.
And what, again, you brought it up because we're huge proponents of pet insurance. Again, just another episode where we mention the benefits that can help open doors financially to these further treatments that can be quite costly.
Dr. Marlowe, I think that we have covered and done a very good job of answering and prepping people for this. I wondered do you mind to do a rapid fire definitions with me?
Sure.
Okay, so there were some things that I heard throughout our conversation that I don't want to take for granted that our listeners know what these
Okay.
things mean. So, if we could just maybe do some definitions here as it relates to cancers. Benign. What does benign
But
mean?
benign would mean that a tumor or growth does not have the ability to invade into surrounding tissues or spread to other places.
And then
So,
the follow up to that.
oh,
Sorry, you
so
continue.
no, I just benign doesn't always mean nothing needs to happen because you can have a benign mass somewhere that just slowly growing can cause a problem, but it's not going to be invasive or spread and metastasize.
And then the follow up next definition is malignant.
So now that tumor does have the ability to invade into surrounding tissue, whether that's nearby muscle or an organ, or spread somewhere else throughout the body.
Which leads to metastasize. What does that
Yep.
mean?
Metastasize is those cells spreading other places from a primary tumor.
Margins.
Yes. So margins are mostly more thinking about surgery. So if you have a tumor that you're removing, ideally you'd want to know ahead of time, is that something benign or malignant? Because if you know it's something malignant, then the margin that you take at surgery. So I usually draw owners a picture of this because it's hard to just kind of say, but you've got the tumor that you can see and feel. And then a lot of malignancies will send out little tendrils, little cancer cells that you can't see and feel. So when you go to remove that, instead of just removing what you can see, you try to put a surgical margin of 1 to 2 centimeters, depending on what it is, around that. So then you're getting those little cells. The whole thing gets submitted for a biopsy. And then you say, okay, how close were those cells to that margin? Different than an actual biopsy margin. So you tried to get centimeters around it, and then the pathologist looks at it and says, okay, the closest cancer cell comes within a millimeter of your surgical margin. That's pretty close. Or it comes up right against it. So now we have an incomplete margin. The concern is there's cancer cells left behind. Or I can see 5 millimeters all the way around. Well, that was completely excised. It's very unlikely there are cancer cells left behind there that are going to try to come back.
Great. Another word that I heard several times, systemic.
Yeah, so systemic would be, I guess, systemic versus localized. So a primary growth in one place could be a localized tumor. Systemic would be potentially to kind of be throughout the body, kind of like metastasis. But some tumors like lymphoma, we call already kind of being systemic because you don't have it just in one place. Usually when lymphoma is found, it is in multiple lymph nodes. It may be in liver and spleen or other places. So that you need a systemic treatment for chemotherapy. You're giving a pill or an IV that's going throughout the body to try to kill those cells versus a single mass in a localized place. You can use a localized treatment like surgery or radiation therapy, something like that.
And remission.
Yeah, that's a great one. So we talk about there are some tumors that we can truly cure. Cure meaning you do not expect it to ever come back. Remission is a lot of times what we're going for in our patients where you, especially lymphoma, you're putting them in remission. So those lymph nodes shrink away. If they weren't feeling good when they came in, they feel better. If they had any abnormalities on their blood work from lymphoma, that's gone. So you don't have any evidence that you have lymphoma, but it's rare that you actually kill every last cancer cell. So at some point, these dogs come out of remission after finishing treatment where their lymph nodes do come back. So that remission is no evidence of that cancer that we can see or find. They feel good. They're in a very good quality of life, but we do expect it to come back at some point.
Are there any other definitions that you seem to cover with people on a regular basis that I left off that list?
No, I think that margins is a good one because I have a lot of those discussions. I mean, I guess the idea of what truly chemotherapy versus radiation therapy
Okay.
is.
Yeah, let's talk about it.
So chemotherapy, we kind of have said systemic a few times, that is damaging that cell DNA. So it works in a few different ways to actually truly go to those cells, damage the DNA. So it's going to happen throughout to all cells. It's just much more preferential for those cells that are turning over faster. Radiation is high energy X-rays. So they're coming from the outside in. So you usually have a imaging, like a CT scan, where you have mapped that tumor. This is exactly where it is. This is where the border is. And now the patient's sitting in a machine that finds where that tumor is and directs high energy X-rays from the outside in. So it's not a going throughout the body type of treatment.
Very good. Is there anything that you want our listeners to know about that we didn't ask you so far in this episode?
Not directly. I think it's more of kind of keeping an open mind. We know that getting a diagnosis for your pet having cancer can be really hard. And I think if there's coming to get that information and just feel that you felt informed, you can make the best decision, that we're not going to try to push you one way or the other. People often ask me, like, what would you do with your pet? And I have 4 dogs, and I'd probably do something different for each of them. Right. So it really is a discussion and trying to figure out what's the best thing. And that best thing might be comfort care. It might be a steroid and a pain medication. It might not be some of these treatments. So I don't want people come in with an open mind to say, I'm going to take this information, digest it, and I'm going to make the best decision that I can for my pet.
Well, Dr. Marlowe, thank you very much for joining us for this episode of the Family Pet Podcast. I know that we've helped answer some questions for our curious pet parents at home, but we need you to share one more fact.
Yeah.
This is time in our show for our fun fact. This is where you're going to share something that will help our curious pet parents win trivia night, or at least impress their friends and family at dinner. So, Dr. Marlowe, what is your fun fact for our listeners today?
Fun's kind of hard for oncology, so I'm gonna go interesting, if that's okay.
Okay.
But we talked about some different reasons of cancer. So there are 2 tumors that we consider contagious, can be spread to one individual to another. One is a TVT in a dog. The other is actually called a facial tumor of the Tasmanian devils. That's the only other species that we know that can have a contagious cancer.
So one Tasmanian devil can have this cancer and spread it to another.
Yes, to another. Mm-hmm. And that's the only that, and actually TVTs in dogs. Those are the only 2 types of cancers that we know.
What is a TVT in dogs?
Yeah, TVT is a transmissible venereal tumor. So it's actually much more common in tropical and subtropical areas like South America, or sometimes we'll have patients that come up from being rescued in some of those areas, and it's a tumor that's oftentimes on their face that can be spread to another dog. They're actually very likely to be cured with treatment, so they can do very well. But it is a problem in places where there's a lot of roaming dogs where they can pass it on to each other. And so there are some groups that go down there and try to treat these dogs and try and prevent that spread. But those are the only 2 types that can actually be spread from one individual to another.
Interesting. That was a fun fact.
Never heard of
I don't know if fun was the right word.
I thought it was interesting and fun. So, well, we appreciate, again, thank you for taking the time. I know you're a very busy person, and I think that this will be a good reference episode for us to send out to any of our pet parents who unfortunately may get a diagnosis of cancer in their pet. So we appreciate you answering some of these questions for our listeners. If you are enjoyed this episode, we do ask that all we ask in return for
just this little thing,
just leave us a right. We are now on YouTube. You just search Family Pet Podcast and leave us a review there, and subscribe to our show there, and you'll get those updates too. So that way, not only do you listen to us, but you get to see our smiling faces too.
Oh, that's gotta be such a selling point.
One of these days, they're going to get to see us fight back then, like the old days. But until that time, we ask that you stay curious.
The
Family Pet Podcast is a podcast for curious pet parents where we believe the more you know about pet health care, the better pet parent you can be. The Family Pet Podcast is a production of Family Pet Health PLLC and is recorded in Murfreesboro, Tennessee. The statements made as a part of this show should not be taken as an establishment of any form of a veterinary client-patient relationship. All comments are for entertainment and educational purposes only, and you should reach out to your local veterinary partner before taking any action on anything that you've heard here today. We hope that you will share this podcast with a friend, and it would mean so much to us if you would take a moment to leave a review and follow wherever you listen to your favorite podcasts. Show notes, links, and videos to accompany today's show can be found at thefamilypetpodcast.com.